What's the difference between LASIK and what is EVO ICL surgery? And that's a great question. In the United States, at least, LASIK has such high brand recognition. Most people think about corrective eye surgery as being LASIK, but there's a lot of other forms of vision correction. So let's walk through two of them, LASIK and then EVO ICL. So LASIK is what most people are probably familiar with. It's a 10 to 12 minute surgery that takes place in two different phases, where we correct the vision at the level of the cornea. That's the clear part of the eye. The first part involves a femtosecond laser docking on the cornea and then creating a thin, clear flap. That flap is then lifted, and the second laser, known as an excimer laser, reshapes the cornea to correct one's prescription. The flap is then laid back down, and then I, as the surgeon, gently smooth that flap into place and make sure everything looks good before the end of surgery. The recovery with LASIK is quite quick. Most people are back to driving and everyday life, including work and even mild exercise, literally the day after surgery. So what is EVO ICL surgery then? EVO ICL surgery is where we take a micro implant. It's biocompatible, it's flexible, it can correct all of your prescription, and we add it to the front part of the eye. So it's an implant actually going inside the front of the eye, and it sits behind the iris, the colored part of the eye, and in front of the natural lens of the eye. So it's sort of sitting in the middle of the front of the eye, and it sits there completely biologically inert. It doesn't cause any inflammation. You as the patient, you can't see it, you can't feel it, you can't touch it, and it sits there until it's time to finally have cataract surgery, typically when someone's in their late 60s or early 70s. And ICL surgery can correct a huge amount of nearsightedness, so as low as about -2.5 or so, and as high as about -16 to -18. And it can also treat a tremendous amount of astigmatism. It can't treat other types of prescriptions. Mixed astigmatism, for the most part, there's some nuance to that, and farsightedness. At least in the United States, EVO ICL is only approved for the treatment of myopia, which is nearsightedness. So both are fantastic options. LASIK and ICL surgery, they're both great. I do both on a weekly basis. I typically will start presenting them side by side if a patient is around about a -6 prescription. Typically less than that, we're recommending LASIK. But if someone wants EVO ICL, I'm happy to do that for them as well. Sort of getting into the higher ranges of correction, -6, -7, -8. There's some studies that suggest that the quality of the nighttime vision may be slightly better with the EVO ICL.